We next have Dr. Samrat CHATTERJEE, and he will be speaking on tough cornea, tougher cataract. So it's on this side. And thank you, sir, for finishing well ahead of time. Yes, you made it. Thank you. Thank you, sir.
So, is there a pointer? So, thank you to the Chairman Scientific Committee CSOS and also AIOS for organizing this talk. So, the theme is, surgical insights from mistakes. So, some carry home points from mistakes that we make. To err is human, but it is also human to learn from the mistake. So, what had happened was that a 39-year-old gentleman had undergone LASIK way back, and subsequently he developed cataract. And then he was operated for cataract elsewhere, and a 12 diopter acrylic IOL was implanted. However, a month after the surgery, there was a pointer है नहीं है तो please दीजिए. Okay. So he landed up with a +5 diopter refraction. So this was the 5 diopter refraction. And when we again refracted him, it was still 5 diopter. And when we repeated his axial biometry for the A scan using the IOL master, at that time we had 500, and also the ASCRS platform, we saw that the average lens was 12.90, and the maximum, because it gives us the ASCRS calculator gives us the minimum, average, and maximum. The maximum was 16.46. But the minimum average was 12.90. We normally use the average, and the patient had undergone 13 diopters. So it didn't add up. So we didn't know exactly why this patient had a +5 diopter refractive error. And the usual reasons that is there is that it can be because of overestimation of corneal power. That is the first mistake that usually happens if we don't use the IOL corrected formula, because of issues related to the anterior and posterior curvature of the cornea. They get altered after laser vision correction. It is because most of the keratometers and the topographers does not measure the center of the cornea. Also, there is the errors with the effective lens position, which the newer formulas incorporate, because the anterior and posterior curvature ratio is altered. Neither can you use the refractive index of 1.3375 for calculation of the corneal power, and also the effective lens power is also not very correct. So in myopia, there is an overestimation of K, and so usually the result is a postoperative hypermetropia, and the opposite happens for hypermetropia. So there are various IOL formulae for doing the IOL power calculation in cases of laser vision correction, and because you can see that there are so many number of formulae and so many techniques, we know that it is still, there is a lot of things that we don't know about it. There's a lot of variability, but normally what we currently use is the ASCRS IOL calculator that uses 3 or 4 formulae to come to the the accurate power. So what had happened to our patient? Because the ASCRS IOL power calculator did not actually give us the true picture. So 13, we are getting 13 diopter, implantation was 12 diopter, but 5 diopter was there. So the clue was, again, when we went back and did a topography and we examined the topography pattern. You can see on the right hand side that the zone of ablation is well centered, whereas in the left eye that was operated, the zone of ablation is decentered. And this decentration has given, has made all the modern formulae erroneous, because the model formulae was overcompensating for the cornea, but in this eye, the light rays or the OCT rays were actually going part from the normal cornea, part from the ablated cornea and the transitional zones. So that had led to the error. And what was the solution? Because the ASCRS power calculators was not giving us the correct solution, so we did the FAK refraction method, where we explanted the IOL, and we then did a manual refraction, took the spherical equivalent and put it into all these formulas that you see out here. So these are some of the FAK refraction formula that you have, and then based on that we calculated it, and we got a power of around 17.86 So we implanted a 18 diopter monofocal lens, and 1 month we got a cylinder of -1 diopter cylinder, and there was no spherical spherical error. So it was correct, and the explanted IOL we had sent back to the manufacturers, and they said it was 12 diopters, so it was not an error in the IOL power calculation. So was it a fluke? It was not a fluke, because we used the same ASCRS IOL power calculator doing the IOL power calculation in the other eye, where the zone was well centered. And you can see that again we landed up with a -1 diopter cylinder after 1 month, and there was no spherical equivalent. So is it only for this? It is not only for this. So following this case, we also operated on 3 other patients. One had a corneal scar that made the IOL power calculation very difficult. In another patient, there was microcornea and coloboma, and the other patient had very significant flattening after RK, in which the ASCRS power calculator was not accepting the corneal values. And in all those things, we implanted it. The error that we had out here was that we presumed that the error like we overcorrected the lens IOL power in the left eye. So these are the solutions that are available. Formula you can actually look up in the net. So if you have a patient with LASIK or PRK, any laser vision correction, rule out if there is decentration. If there is decentration, then probably the existing methods are not correct and can land up with refractive surprises. Thank you.